set up Games for Health Europe in 2010. I thought it was a good idea because we saw the development of games in healthcare coming up in Europe, but there wasn't really a place where people could change their ideas or exchange expectations, exchange research. And I thought, why not bring what they've done in the United States already and doing for a long time to Europe, so we also have an exchange of knowledge and information between United States and Europe. Yeah, the exchange of information and knowledge is really happening now for the 4th year and growing every year. We even published a peer-reviewed book published by Springer, where researchers could find a podium basically to publish their research, because there was not really one podium except the Games for Health journal to publish the articles. Yeah, we had a feeling in 2010 that in Europe there would be a demand for games in healthcare to improve healthcare, make it affordable and more fun. But as we all know, with cars, before there were cars, the people wanted probably horses that eat less, and etc. And the rest. So we start initiating by presenting that there were games in health to improve health, healthcare, make it affordable and more fun. And then people start really, oh, this could be a solution for a problem we're facing or a challenge we're facing. And then what we see now, after a couple of years, is that that it's not sending, but that there is a demand coming from the market. We see the demand growing in Europe, in some countries more than other countries. The northern part of Europe, it's a bit higher the demand than in the south, for various reasons. But everywhere we see it growing. The demand is coming from all sides. We see, of course, consumers, and in the end, patients in the beginning, becoming people again by getting technology that gives them control of their own life and on the quality of life. But also from healthcare professionals who seek solutions for how can we control, how we can collect data, how can we manage large groups of people, etc., etc. So we see it in all aspects, and that's, I think, very interesting in healthcare insurance companies, because a lot of games are therapies on its own, and healthcare insurance companies accept that these games are therapies because they are. And if a doctor prescribes them, the healthcare insurance company pays for it. We departed from the idea that games would be a therapy on its own, and validated, of course, but not all, because we discovered that 70 to 80% of all therapies are non-validated and still used and being paid by the healthcare insurance company. So we also had the discussion with them. How is it possible that you're requesting for us new games, or what you think that are new games? The games are new, but the therapy is old or used and proven. So why, if we make a game out of that therapy, should you request a validation on it? And of course, I believe strongly that if there is a validation, that the proof is there and that there's no discussion about it anymore. But I also stress companies and organizations and people to give the industry a little bit of time, because validation takes time, and we are still intelligent human beings to see whether something works or not. And that's what we call evidence-based or experience-based. And I think that's also the responsibility of a patient, of a human being, and of a doctor, that if someone sees it working, we might use it, even it's to give people a good feeling. And the half of the pharmaceutical industry, for example, is based on placebos. So there's a whole industry where 50% is built on something in between your ears.